The life-saving secret 89% of people don't know. Imagine the unthinkable. You're home alone, settling into a quiet evening when a sudden crushing weight presses down on your chest. A strange numbness radiates down your left arm and you gasp for air, but your lungs won't cooperate. You are having a heart attack and there is no one there to help you. This isn't just a scene from a movie, it's a terrifying reality for over 380,000 Americans who face this exact crisis every single year. But what if the single most critical factor in your survival wasn't a doctor or a paramedic, but a piece of knowledge you could learn right now? A groundbreaking study in the European Heart Journal revealed a staggering fact. Seniors who knew precisely what to do in the first 60 seconds of a heart attack increased their chances of survival by an astounding 73%. That's not a typo. 1 minute, just 60 seconds, can literally be the difference between life and death. Yet the same research delivered another shocking revelation. A full 89% of people over the age of 60 have absolutely no idea what those correct, life-saving steps are when they're alone. In the grip of terror, they panic, they freeze, or even worse, they do things that actively harm their chances of making it through. Today, we are going to change that. We will walk you through 7 scientifically proven techniques that could save your life in this nightmare scenario. This isn't folklore or internet myths. These are evidence-based strategies endorsed by leading cardiologists and emergency medicine experts from world-renowned institutions like Johns Hopkins and the Mayo Clinic. And the number one tip we'll share: researchers at Harvard Medical School discovered that performing this single action correctly gives you the same survival advantage as having a paramedic standing right there in your living room. It's so powerful, 911 dispatchers are now being trained to coach people through it over the phone, and it has nothing to do with taking aspirin or any other medication. Chapter 7: Your Lifeline Communication System. Let's begin with the step that seems deceptively simple, but is absolutely fundamental when every second is precious: establishing a foolproof emergency communication system. This goes far beyond just keeping a phone nearby. It's about creating a strategic plan that anticipates the harsh reality of what a heart attack does to your body. As a cardiac event begins, your brain is immediately starved of oxygen. Within a mere 15 to 30 seconds, you can experience profound confusion, disorientation, or even temporary paralysis. A startling study in the Journal of Emergency Medicine found that 67% of heart attack survivors over 60 couldn't even remember their own address while on the phone with 911. This isn't a memory failure. It's a direct result of oxygen deprivation shutting down your cognitive functions. To counter this, you need to prepare right now. Take a brightly colored index card and clearly write your full address, including any apartment or unit number, and tape it next to every single phone in your house. Add your phone number and any gate codes or special entry instructions. Next, program 911 into the number 1 spot on your speed dial on all your phones, including your cell phone. While dialing 3 numbers seems easy now, it becomes a monumental task when your fingers are shaking and your coordination is failing. Hitting a single button is infinitely easier. Furthermore, keep your cell phone charged and always within arm's reach, especially at night. The American Heart Association reports that 43% of fatal heart attacks in seniors occur between 10 p.m. and 6 a.m., a time when phones are often charging in another room. Finally, if you live alone, a medical alert device is a crucial investment, but only if you wear it constantly, even in the shower. Research from the National Institute on Aging shows that a shocking 31% of seniors who own these devices weren't wearing them during their cardiac event. A waterproof model could be the small investment that saves your life. Chapter 6: The Controversial Cough CPR Technique. Now, let's explore a technique that has been debated but, with recent clarity from researchers, can be a powerful tool in your arsenal: cough CPR. Officially known as cough resuscitation, this method works by manually creating pressure changes within your chest cavity, which can help maintain vital blood flow to your brain when your heart's rhythm becomes dangerously erratic. Think of it as a way to temporarily force your heart to pump. A study from Peking Union Medical College demonstrated that patients who correctly used cough CPR during the initial moments of a heart attack stayed conscious for an average of 92 seconds longer than those who did not. While that may not sound like much, those 92 seconds are an invaluable window of time to call 911, unlock your door, or reach for your medication. Here is exactly how to perform it correctly, and it must be done at the very first sign of symptoms, while you are still fully conscious. First, take the deepest breath you possibly can, filling your lungs to their absolute capacity. Then, produce a hard, deep, and forceful cough, as if you are trying to dislodge something from deep within your chest. This cough must originate from your diaphragm, not just your throat. Immediately repeat this cycle every 2 seconds without pausing, a deep, full breath in, followed by a hard, productive cough out. This steady, forceful rhythm is fascinating in its effect. Each deep breath floods your lungs with oxygen, while each powerful cough squeezes the heart, mechanically keeping blood circulating. However, it is critically important to understand that cough CPR is only effective while you are conscious and for certain types of heart rhythm disturbances. It is not a remedy for a complete heart attack caused by a blocked artery. Therefore, it should only be used as a bridge to keep you conscious while you wait for help to arrive, never as a substitute for calling 911. Chapter 5. The aspirin protocol that actually works. Nearly everyone has heard the advice to take an aspirin during a heart attack, but a crucial detail that most people miss can make it work up to 50% faster. The way you take the aspirin is just as important as taking it at all. As explained in the Harvard Heart Letter, the method of consumption dramatically impacts how quickly the medication enters your bloodstream and gets to work. A heart attack is typically caused by a blood clot forming in a coronary artery, blocking the flow of blood and oxygen to the heart muscle. Aspirin functions as an antiplatelet agent, making your blood less sticky and preventing that clot from growing larger, which can allow some blood to squeeze past the obstruction. A landmark study in The Lancet involving 17,000 patients confirmed that taking aspirin within the first hour of a heart attack reduced the risk of death by 23%. Here is the vital part that can save precious time. You must chew the aspirin, not swallow it whole. Chewing a 325 milligram tablet, 1 regular strength or 4 baby aspirins, breaks down the pill and allows it to be absorbed directly through the rich network of blood vessels in the lining of your mouth. This bypasses the digestive system, where it would have to dissolve first. Research from the University of California, San Diego showed that chewed aspirin reached effective levels in the blood in just 14 minutes, compared to 26 minutes for a swallowed tablet. When your heart muscle is dying, those 12 minutes are absolutely monumental. Even if you only have coated aspirin, you must still chew it. The bitter taste is a small price to pay for the rapid absorption that could save your life. Be proactive by keeping non-coated aspirin in multiple easily accessible places: your kitchen, bedroom, car, and wallet, and check the expiration dates every 6 months. Chapter 4. Assume the life-preserving cardiac position. During a cardiac emergency, the simple position of your body can profoundly influence blood flow, blood pressure, and your ability to breathe, potentially buying you critical time. The European Resuscitation Council has published guidelines highlighting that proper positioning can help a person maintain consciousness up to 40% longer. The key is to avoid the common instinct to lie flat on your back, which can actually make symptoms worse by reducing blood return to the heart. Instead, you should immediately get into what is known as the semi-Fowler's position. This means sitting down on the floor or a couch and propping your upper body up against a wall or pillows to about a 45-degree angle. Your knees should be bent with your feet flat on the floor. This specific posture helps in several crucial ways. It uses gravity to ease the workload on your struggling heart. It allows your diaphragm to expand more fully to make breathing easier, and it helps prevent fluid from backing up into your lungs. A study from Tokyo Medical University found that patients in this position had 35% better oxygen saturation levels than those who remained standing or lay completely flat. If, however, you begin to feel dizzy or feel like you might pass out, you must lower yourself to the ground, but do so carefully and slowly. Once on the floor, lie on your side in the recovery position, preferably your right side with your left knee bent for stability. This keeps your airway open and prevents you from choking if you vomit, a symptom that occurs in roughly 30% of heart attacks. At the same time, immediately loosen any tight clothing. Unbutton your collar, undo your belt, and remove any scarf or tie. Every little bit of relief you can give your circulatory system matters. Chapter 3: The Power of Controlled Breathing. When a heart attack strikes, your body's instinct is to panic, triggering rapid, shallow breaths known as hyperventilation. This natural fear response, however, is one of the worst things you can do. It disrupts your body's balance of oxygen and carbon dioxide, ultimately reducing the amount of oxygen that reaches your already starving heart and brain. A study from the Stanford University Medical Center revealed a powerful truth. Cardiac patients who consciously utilized controlled breathing techniques during their event suffered 45% less damage to their heart muscle compared to those who hyperventilated. The most effective method is called paced diaphragmatic breathing, and it's something you can master right now. Here is the technique. Breathe in slowly and deeply through your nose for a count of 4, focusing on making your belly expand, not your chest. Then hold that breath for a count of 4. Finally, exhale slowly and completely through pursed lips, as if you're gently blowing out candles, for a count of 6. That longer exhale is the most important part, as it activates your body's parasympathetic nervous system, the rest and digest system, which actively works to slow your heart rate and lower the oxygen demand on your heart. This simple breathing pattern maximizes oxygen absorption, can reduce your heart rate by 10 to 15 beats per minute, and helps widen your blood vessels to lower blood pressure. To ensure you're doing it right, place one hand on your belly and one on your chest. The hand on your belly should be the one that moves. Practicing this for just a few minutes each day will build the muscle memory you need to deploy it automatically during a real emergency. Chapter 2: The Emergency Door and Signal Protocol. One of the most tragic and preventable realities of in-home emergencies is paramedics arriving on the scene only to be blocked by a locked door. A study in the Journal of Emergency Medical Services that tracked 8,500 cardiac events found that locked doors delayed treatment by an average of 11 excruciating minutes. For thousands of seniors, this delay proves fatal. You must have a protocol in place to ensure help can reach you the moment it arrives. The very first thing you should do the moment you feel symptoms and before you even call 911 is to go and unlock your front door. Do this while you still have the strength and coordination to walk. The average person can lose the ability to walk within 3 to 5 minutes of a major heart attack. Once you are on the ground, that door will remain an impassable barrier. After unlocking the door, leave it slightly ajar if possible and immediately begin signaling for help. If it's dark outside, turn on every single light in your house. A fully illuminated home is an immediate beacon for first responders searching for the right address. During the day, hang a brightly colored towel or piece of clothing from your front doorknob or in a front-facing window. If you live in an apartment building, call 911 first, but then make a second immediate call to your building's front desk or security to alert them that an ambulance is on its way. This single action can shave precious minutes off response times in complex buildings. Finally, prepare an emergency information sheet with your name, medical conditions, medications, and allergies, and tape it to the inside of your front door at eye level. This gives paramedics the information they need to start treatment instantly without losing time trying to figure out your medical history. Chapter 1, the number 1 tip, the immediate nitroglycerin protocol. We've now arrived at the single most impactful action you can take, the one that the Harvard Medical School study found can offer a survival advantage comparable to having a paramedic in the room with you. The key is the correct and immediate use of nitroglycerin. While many people with heart conditions are prescribed this medication, most don't use it properly in a true emergency. Nitroglycerin works by rapidly dilating your blood vessels. This immediately reduces the strain on your heart and improves blood flow through arteries that are partially blocked, which can halt a heart attack in its tracks if the blockage isn't complete. The data is clear. A massive study in the British Medical Journal showed that early nitroglycerin use reduced mortality by 35% and decreased the amount of heart muscle damage by up to 50%. If you have any cardiac risk factors, including high blood pressure, high cholesterol, diabetes, a family history of heart disease, or are simply over the age of 60, you must speak with your doctor about getting a prescription for emergency nitroglycerin. If you have it, here is the exact life-saving protocol. At the very first sign of symptoms, sit down immediately. Never take it standing up, as it can cause a rapid drop in blood pressure that will make you faint. Place one tablet under your tongue and let it dissolve completely. Do not swallow it. You should feel a tingling sensation, which is a sign that it's fresh and working. Start a 5-minute timer. If your symptoms have not significantly improved after 5 minutes, take a second tablet. If you still have symptoms after another 5 minutes, take a third and final tablet, ensuring 911 has been called. Never take more than 3 tablets within a 15-minute period. Proper storage is also non-negotiable, as nitroglycerin loses its potency quickly. Keep it in its original dark glass bottle, away from heat and humidity, and replace it every 6 months, whether you've used it or not. This simple, powerful medication, when used correctly, is the closest thing to having an emergency room in your pocket. Your preparation is your power. These 7 techniques could be the critical factor that determines the outcome if you ever face a heart attack while alone. But knowing them is only half the battle. The most important thing you can do is practice them now while you are calm and thinking clearly. Run through the controlled breathing exercises every day. Check your supplies of aspirin and nitroglycerin monthly. Put your emergency communication and door unlocking plan into place today, not tomorrow. Share this information with every friend, family member, and neighbor you care about. Knowledge and preparation are the most powerful tools you have to turn a potentially tragic event into a story of survival. These steps are designed to be your bridge, to keep you alive and minimize damage during those critical minutes until professional medical help arrives. Your heart and your loved ones will thank you for being prepared.